Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Weaning.
Okay, so today's topic, we're going to cover what is the best topical ointment or cream to use on my arthritis or my sore muscles or bones.
Ooh, a lot of people are looking for the answer to this one,
Yeah.
so stay tuned.
Okay, first of all, why do we like using topical treatments for like arthritis of the knee or the hand or sprains and strains?
Because they smell good.
They smell awesome though. That's not the answer. They can smell good. But the main reason we like topicals is because they're safe.
Yes, totally agree. I love using topicals. If they can reduce the number of pills any of my patients have to take, especially my older patients, love the topical.
I have some elderly patients that take so many pills. I'm like, do you have room for lunch?
Yeah.
Like you're on so many different medications.
Do you have time to eat lunch? Because
It's
you got the pill
filling.
set out there, you got...
Yeah, the whole tray, you open day 1, day 2, day 3, and day 1's got like 50 pills in it. It's confusing. I'm on one medication, I'm gonna say, that I'm supposed to take every day. I can't even remember to take it. So if I start twitching or fall asleep while we're talking, it's because I haven't taken my medication. No,
Okay.
All right, so we like them because they're safe. Anti-inflammatories in your topical, for example, if you took an anti-inflammatory pill,
Yep.
like an aspirin type of pill, there's some risks with that.
Yeah, I worry about my stomach, I might worry about bleeding, I might worry about blood pressure, kidney function, how it affects my diabetes, so many factors.
Yeah, I mean, these complications are rare.
And those medications are very effective in a supervised setting. However, it's always safer to not take it.
Yeah, because they carry some risk. Okay, so we like topicals because they're safe.
Okay.
We like topicals because they're effective.
Yes.
They deliver the treatment right to the source of the pain, right? You've got a sore thumb, you're putting it on your thumb. Sore knee, you're putting it on your knee.
Right.
Instead of taking it and having it go through your entire bloodstream to get to that part, you're putting it right on that part.
And science is more organized now too, so they do studies to show that using a topical that has some medicine in it versus a topical that's just a placebo, the one with medicine actually works. And they've tried lots of different kinds of things.
So we have evidence that topicals are effective.
Yep.
Okay.
I like that they're versatile. You can put a whole bunch of different things in a topical.
Multimodal, that's the buzzword right there. Now our pain gurus and our specialists say that we have to use a multimodal approach to pain, which means don't just use one thing.
Right.
Use a bunch of different types of things, and you can get topicals that are multimodal.
And when you say multimodal, you mean like anti-inflammatory, muscle relaxant, nerve agent, local anesthetic. There's a whole bunch of different choices.
Right, right. Okay, so that's why we like topicals. So what is
I got one more thing.
Huh?
Is it easy to use or hard to use?
They're very hard to use because you have to put a dab on your finger and put it on the spot. I'm just kidding. They're easy to use.
Easy to
right?
use.
Very easy to use.
Okay.
And you know, guys like us, we don't look at the instruction manual. You know what I mean? For if I'm putting together a table or a desk, I don't look at the instruction manual.
Nope.
And I usually put it together wrong.
Yeah.
Except for when I'm doing surgery. Of course, I look at the instruction manual there.
Yeah.
Okay. So that's why we like topicals. Now, what is the best topical to use?
I think the answer is that it really depends
Right.
on a whole bunch of things.
What's in it?
Yep.
We're going to give you the tools here to understand what to look for inside a topical that might work. Okay?
Yep.
So, first of all, I think it's important for it to have an anti-inflammatory component to it. Something in there that's an anti-inflammatory.
I'd agree. I like that. I like some type of anesthetic in mine.
Yeah, something that's going to sort of calm the nerves down,
Yep.
and just give some kind of anesthetic. And then you can get into have something in there that might act on the muscle a little bit.
Yep.
Something that's going to relax the muscle in the area because you can get some muscle spasm around these sort of musculoskeletal pains.
And then I would say the last thing is that a lot of pain pathology relates to functions of the nerves. So something that maybe can have a specific effect on the nerves.
Yeah. So if you can find a topical that has a few different components in it that can attack the pain pathways from those different angles, that's going to be your best one. And ultimately, because they're so safe and easy to use, you can try a few different ones and see which one works for you.
Yes.
Okay? Some work better on some people, some work better on other people.
And it is a little bit of trial and error for sure.
Yeah.
I would say the other thing that seems to be coming along the pipe is CBD and things like cannabis type products in a topical is potentially going to be the future of some of these types of products.
that is something coming down the pipe. There hasn't been a ton of evidence yet on that because they're just gaining approval over the next year or two. However, there are some studies showing that they're going to look at that question down the road.
I think that's,
There you go.
that's pretty
That's
good.
a topical. We're big fans of using topical treatments for musculoskeletal problems. We've sort of given you the idea what our take is on what a good one would be.
Do it with the supervision of your doctor, though. Too. Ask suggestions, mention what you're thinking about, and then you can kind of decide together.
Sure. Often you need your doctor because some of these are over the counter, but the over the counter ones usually aren't multimodal and usually aren't very strong.
That's
if
right.
You can get the prescription strength ones usually get the drug levels, the topical drug levels up to a point where they can actually have a good effect.
Yeah. So hey, if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.